Well, greetings everyone. Welcome. Glad to have you join me today. Our topic today is improvisation and transformation. These two go together so well, and unfortunately, oftentimes not implemented as much as it should be in our therapy, coaching, hypnosis sessions. So, I want to spend some time today talking about the importance of improvisation, making the case for more improvisation in our sessions, and because it does oftentimes lead to transformations. If you are unaware of my work, you just somehow found me, thank you for watching this video. I'm Paul J. Leslie. I'm a teacher and author, transformational strategist, psychotherapist, coach. Try to be a decent guy, and I share these videos to hopefully help people become better in the healing arts. I really work to help professionals in the healing arts to become more effective, more transformational, and more magical in their outcomes. So let me talk about what therapeutic improvisation is. I view it this way. This is an antidote to all the overly regimented sessions that we often find ourselves with, all the rigid techniques and sometimes scripted methods that we can find ourselves relying on. And it's really a wonderful way to keep our medicalized ways of working, particularly those of us in the psychotherapy world, kind of restricting that so we don't become too medicalized, too pathology oriented, too much problem focus interventions rather than resource directed ways of working. And essentially it helps us from having these boring and sometimes just lifeless interactions that we sometimes can have with clients. It doesn't mean that we have to always put on some amazing presentation and show every time we're with our clients, but we just don't want to be the type of person working with people that is boring, that is lifeless. It just isn't really connecting with clients. So let me define improvisation. So I looked this up. Can't remember which dictionary. I have the English dictionary pictured here, but basically it's definitions to recite, play, sing, make, invent, arrange, and to make or fabricate out of what is conveniently on hand. This is the one I really want you to focus on. To make or fabricate of what is conveniently on hand. Because when we're working with clients, sometimes they'll say something, do something, sometimes things will come to our mind, and we're being given something. And when we don't utilize those things that we're given, we oftentimes miss opportunities to open up areas to go into that can offer us wonderful access to client resources and strengths and solutions and new ideas where we can go, where if we're not kind of being more in the moment, open to what is happening, we often miss some potential openings for transformation. So I included this from Kenneth Gergen, his Relational Being Beyond Self and Community book. I found this quote in expanding the potentials of action-oriented therapy. Much would be gained by collaborating with specialists in improvisation training. In a world of complex relationships and mercurial fluctuations in meaning, we must increasingly rely on improvisation for effective co-action. Now, right here, much would be gained by collaborating with specialists in improvisation training. I have oftentimes encouraged people who've trained with me, whether they're trained to be therapists, coaches, hypnotists, alternative healers, to maybe take an improvisational acting or comedy class if they don't feel secure in being able to use what is at hand. Because as it said, all these fluctuations in meaning and relationships, a lot of times to really create a magical session, to create an opening to transformation, we do have to become comfortable with not knowing and not knowing what will happen next. You know, the cyberneticist and physicist Heinz von Forster said, we have to act in order to know. That's an important thing for us when we're working with our clients, because sometimes we've got to say something, do something to see where it goes rather than try to figure out, control, whatever, because we miss that opportunity. And we don't want to miss any opportunity when we're trying to help people transform their lives. So I also like this one from Pagano in the American Journal of Psychotherapy. It's the therapist's use of self through playful improvisation is a critical and often necessary vehicle for change and growth in the patient. Because whatever is happening, Pagano is saying whatever essentially is happening with them as happening with us, and we activate a parallel shift in the patient or the client. And I think that's important. So if we're allowing ourselves to be open to new ways of expressing ourselves, new ways of interacting with the client, that will activate that connection with the client. Once the client and you begin your work, you now are not a you and them. It is now a we. It is creating this own little system. And the way to help a system transform is to perturb the system, meaning that in order to help someone change, you have to change yourself first. And by change yourself, I mean you have to be open to going in directions that you don't normally go in. You have to be comfortable with allowing things to emerge and to be creative in that moment, because you'll never know how things will go. You probably have the experience of saying something that you think is helpful and somebody is confused by it or is offended by it, and you're saying, I was just trying to be helpful. Other times you say something offhand and your client comes back and said, when you said that, that changed everything for me. And you're wondering what the heck they're talking about. So just being open is so important. So here's some benefits I list here of improvisational work in the sessions. Clients generally will attend more closely to themselves and to you if you're more comfortable free-flowing at certain times, and it helps create a co-creative environment that can be very supportive. It aids in avoiding narratives of limitation and pathology. So the more you're able to go in different directions, the more you can help clients kind of come out of that mental prison that they've set for themselves. It helps in shifting context, so we get out of the problem-focused, pathology-oriented into a more resource-focused, a more resource-directed, strengths-based way of helping our clients. And it encourages us and them to be in the moment, and loosen any kind of rigid ways of thinking and feeling. And what you will find is the more you're open to what emerges, it's going to increase your ability to really listen, to really become aware of the clients and yourself, to increase your creativity, to create that empathy. I think if you haven't tried this, you're going to find that it opens up a whole new world of the work. If you're already doing good work, it's just going to make it better. So just think of when you're improvising with your clients sometimes that there are really no mistakes. It's just whatever's happening just becomes incorporated into a larger pattern. And then all actions become justified. And by all actions, I mean all ethical actions. You don't want to do things that are immoral or dangerous or harmful to your client, obviously. But sometimes going and talking about things that don't seem to have anything connected with the problem is a justified thing. Asking your clients to do sometimes strange, odd, little ritualistic actions outside the therapy room that just seem to occur to you no longer becomes I don't know if this will work or not, because even if it doesn't work, it's part of a larger pattern, and then all of these things can kind of come together for the client's greater good. So we're going to plan ahead, right? Well, if you've worked with anybody for more than 5 minutes, a lot of times the best laid plans just don't go anywhere. And if you're so planning ahead, that means you're trying to control the session. So by planning too much, it removes you from being incredibly attentive to what's being presented in that moment. So if you're saying, I just can't wait till the client shuts up so I can apply this new technique I learned, now it's not only you trying to control the session, but you're also maybe missing things that the client's saying or how the client's being. If you're so tied to technical maneuvers and theories, you miss so much. It's good to have the techniques. It's good to have the theories, but planning too much without any leeway of opening to new ideas sometimes can be very restrictive. So I found that in having a magical session, the real magic is essentially that every individual client has a unique theory. How you work with them is going to be totally different than how you work with other people. And this is kind of a magical thing because that theory is constructed in the moment of interaction, in that creative improvisational change. How you do a certain language pattern, a certain swish pattern, a certain hypnotic intervention, a certain therapy technique may be similar among other people, but how you do it, when you do it, the way you do it, how you preface it is going to change. And being okay and comfortable to just going with what life gives you is how the magic tends to seep into the session, and it can be quite astounding. So let's start with our basic premise. I've talked about this on other videos. Is when we meet with a client, the client generally has a problem. This could be an emotional, mental problem, business problem, relational problem, whatever it is. But they see whatever's happening in their life as a problem. So they have a perception that something's happening, this is a problem, or they're in some performance of some action that is, doing something that they call a problem. Now, the natural thing that clients do is try to find a solution to their problem. So sometimes they'll try to do less of the problem, sometimes more of the problem, try to banish the problem, whatever it is. But if that does not alter the problem, what ends up happening is it gets them caught into a loop where the more solution, the more problem, the more problem, the more solution. So applying attempted solutions that don't work only locks in and creates a total circularity in the interaction between problem and solution that now the client find themselves stuck. But at the same time, it's not always just the client, it's the coach, it's the therapist, it's the healer that gets stuck. Because what we end up doing a lot of times is not allowing the flow of the session to go because we're trying to apply a certain theory or technique, but that's oftentimes an attempted solution. Let me explain. Way back when, there's this guy named Freud. Sigmund Freud had this idea, and I'm not saying it's an invalid idea because I think there's some validity to some of it, but the primary issue we have are our unconscious conflicts. So whatever the problem is, it's due to unconscious conflicts. So he came up with a whole series of solutions and techniques and things to help with the unconscious conflicts. Now sometimes those worked, sometimes that didn't. But either way, they're now still locked inside this context of problem and solution. It's just now we're not saying this is the problem, we're calling the unconscious conflicts are the real problem. Now we move into behaviorism, and it's now learned behaviors. You're learning certain things throughout life, at childhood, at adulthood, whenever, and now you've learned them, and it's so ingrained that that's the problem. So the behaviorist didn't believe in any unconscious repression and conflicts. It just said, there's learning that you have that isn't effective. So now that the solution is whatever they come up with to combat the problem of learned behaviors. But you notice we're still in that same context of problem versus solution, and it can be a little tricky. Because when we're stuck inside this, it limits our ability to access other strengths, other resources. Then we move into the humanistic realm where it's our self-esteem, our conditions of worth that are driving all of our major problems. So we feel bad about ourselves and we make bad decisions. Now, it's hard to argue with that. But at the same time, from a coach, therapist view, we're still stuck in this idea that, okay, the condition of worth is the problem, I have to have a solution. So maybe it's self-esteem training, maybe it's reading self-help books, maybe, my therapist has different self-assertive techniques I do, but we're still kind of caught in here. So if we're so married to a theory that it's conditions of worth, then we're going to only apply certain solutions that are tied to that theory. And here we are stuck in this circularity that's maybe a little difficult to get out. And we move into the cognitive realm, all the cognitive behavioral therapy, rational emotive behavior therapy, cognitive restructuring, all these kind of things come with the basic idea that your problem is that your thinking's distorted. Your thinking is limited. Your thinking is not helpful. Your thinking is negative, whatever it is. And if we can just fix your thinking, then you should have no problems. And sometimes that's the case. But again, we're still stuck in this. We're married to the solution. You can't have a solution without a problem. So now what we're trying to do is enforce more solution onto these distortions, and we're back into that circular problem solution. Now you hear a lot about attachment issues. Well, you see, the problem isn't just learned behavior, and it's not conditions of worth. Those are all tied to attachment issues. So now we're back in here with sounds really cool. I love how it's so new, but we've been talking really attachment issues for 50 plus years. But this is the new thing, and because of your early childhood, you got these attachment issues, and that may be so. But now we've set up for change a rather difficult paradigm. The solution now has to overcome the attachment issues. We have to do certain things to help with the attachment issues. So whatever it is, we are now trying to eradicate the attachment issues, change the attachment issues. And again, not saying that that's always a bad thing, but it still creates this limiting way of interacting with another person because we're fitting them solely into this box, and oftentimes that can be a problem. And now you go to the biological realm where you have an overactive amygdala. Could be 100% true, but now that's the problem. If we can just calm down your amygdala, then we're fine. But the solution is maybe more mindfulness, more breathing exercises, or whatever that is. Again, none of this is too bad or even bad at all, but it's still caught in that paradigm that one side is reinforcing the other and the other's reinforcing that. So it's hard to get away from this because this is unfortunately how we view change, a very linear way to where one side, if we can get rid of one side, maybe somehow the other side will then be kind of utopia living. You're fine, you have no problem. And now, of course, we have to go to the biological. Now it's a chemical imbalance, which a lot of dispute on that. But so it could be. In some cases, it may be strictly biological, and the solution is medication. In some cases, very warranted. I'm not anti-medication at all. But in some cases, maybe not. So now we've seen all of these different answers to what the problem is. And what are they going to do? They're going to apply their solution, whatever that solution is, based on their theory. So they are literally creating a way of working based only on one way of seeing this problem. So when you have both the healer and the client are so locked into that solution-focused or problem-focused, really, not solution-focused, but problem-focused paradigm, it's a problem context. And both can become more and more frustrated when things don't seem to magically disappear. And they also will feel kind of limited in their results. Because if you're locked into that frame that, oh, well, I need to do more mindfulness, or you need to meditate more, or you need to, challenge your thinking more, whatever it is, based on whatever theory and technical way you have of seeing it, you might miss a lot of potential ways to help people that maybe might never have occurred to you. So the way I've seen it throughout my career, and something that I beat the drum on and on about, is to help people, the best thing we can do is get out of this first order solution problem format. Some problems are small and they don't need to adjust the whole system because that's what's happening. The problem's fueling the solution's fueling the problem if the solution hasn't cured this. So the best way to do it is to get outside the frame of a problem, outside the context, because resources are always located outside of that. So certain behaviors, certain thoughts, certain experiences, when you get outside that rigid back and forth way of trying to overwhelm something, trying to underwhelm something, and just moving outside, something that might seem like totally not even helpful initially, you find that it may have great help to the problem if it's a positive resource, a strength, some kind of experience that the client can pull from and really gain some insight, if you will, into how much strength, how much resourcefulness that they have inside. And it's hard for them to see that when they're locked inside the solution problem paradigm. So the way to get them out of these problem contexts and move them toward these resources is improvisation. Now, as we said, we're taking what's at hand, whatever it is, we're taking what's at hand and we're trying to implement in the moment as a way to move them out of that systemic problem solution rigidity out of that into a whole new way of seeing the problem, whole way of doing the problem, whole way of just being. And this requires intuition. Now, what I mean by intuition is this is where it's so important, as I say, trusting your gut. You'll get ideas sometimes, you'll get feelings, you'll get hunches. And having the clinical wisdom, if you will, the intuition to say, yes, pay attention to this, pay attention now, this is important. Or sometimes things flash in your mind and you say them, you just ask them. You even say, hey, this is going to sound weird, but I just got this image or I just got this thought. And you say it to the client. But now this is important because you guys may be connected at a much deeper level than you realize, and maybe your unconscious mind's picking up things that you don't even know, and it's trying to let you know things. So honoring that intuition. But again, it takes the wisdom to know when to say something and when to not. As one of my students said, I try to plan to improvise, and it messes up. And I said, well, that's your problem. You're planning to improvise. It's like, be spontaneous now. It's just, you lock yourself in. So when we allow ourselves to trust ourselves and really be open to what's coming up out of this moment of interaction, we kind of indirectly give our clients permission to do the same exact things for themselves. So that allows them the permission to think in a little different way, to do things in a different way, to experience things in a different way. So I found this back many years ago called Scoring a Session. This is based on the work of two brilliant therapists, Wendell Ray and Bradford Keeney. I think this was written back in 1993 in a book called Resource Focused Therapy. Not a lot of folks know about it, but sometimes the latest and the greatest, not always the latest and the greatest, and we can learn a lot by going back and checking out what came before. But they talked about scoring a session, kind of like a 3-act play. And you kind of think of a 3-act play as, you have the initial situation, and then you have a transition scene in Act 2, which then leads to the finale. So they came up with the idea that when you're taking a session, you start with the problem. The problem's in Act 1. And somewhere in there, as we're honoring the stories and trying to understand our client, where they're coming from, that we take a transition in Act 2, which leads us in a totally different direction, into more resourceful ways of being, more strength-based context, which then leads us out in Act 3 into the realm of healing. So if we think of Act 1 as the problem, this is when your client comes in and says, I'm depressed, or my business is losing money, or I don't feel I'm confident to give a speech, or whatever it is. That's the problem. So at Act 2, it's our transition out of Act 1. But this is where the improvisation comes from. Asking your clients about things, ask them to do things, that they haven't thought about. Opens a gateway, moves them out of Act 1, out of that solution problem frame into Act 3, which we're in a new context. And if we've done this right, Act 2 has led us to Act 3, which is the focus on client strengths and resources. And then the rest of the session, we are focusing only on the information and the ideas from Act 3. So let me give you a little case study exercise. So I just kind of threw this one together. This is about a guy named Ronald who's got some depression and feeling he's not has a purpose, and he's gone to see any other therapist, but found that even though he liked them, he didn't have any shift in how he felt. He's had an experience of traditional psychotherapy. So if you allow your intuitions to come up with 3 actions the next therapist could do that are out of the ordinary, might create a shift in Ronald's way of experiencing therapy and maybe his depression, what would that be? So I would challenge you, if you want to, stop the video for a second and just think about 3 things you could do. So I'll give you a handful of things I just kind of came up with. And again, I don't know if any of these would work because I don't have a real person with this, but it would be interesting to see, what came of it. So first, we could ask Ronald to change seats with you if they always sit in the same place. So if Ronald always sits in the same seat, maybe ask him to change seats. You could ask him if you could speak with an unusual accent for the whole session. Open the DSM and ask Ronald to rip out a page with a disorder he likes better than the one he thinks he has. I've actually done that one with a client. It was kind of cool. You can ask Ronald to help you rearrange the furniture in your office. Really laugh out loud when something funny happens in the session. You can ask him to color with crayons with you during the session just so you both can relax. Write a song or poem with Ronald about his issue. You can create a healing ritual spontaneously and something that's constructed for him to move forward in his life. Now, when you look at these things, these are not the kind of things that we generally see in our therapy or coaching training. It is usually very problem-tied techniques and maneuvers. And again, none of these may work, or they may all work, depending on the interaction in the moment with that specific client. So let me give you a real case. And this was a doozy of a case. I had this client, wonderful lady, who I'm going to call Andrea. And Andrea came in for issues with grief, bereavement, depression, anxiety. This is a young woman who's just been through it. I mean, history of physical, emotional, sexual abuse. When she was young, she had to go live with her aunt for some reasons we won't get into, and her aunt, a very young girl, pimped her out basically as a child for drug money. So she kind of forced her into prostitution so the aunt could have drug money. She later grew up and got married, and her ex-husband was incredibly violent and basically went to prison for abusing her, almost to the point of killing her. She was in ICU for a good long time. And then she suddenly had a situation where her grandmother and mother, who she loved very dearly, and then her young son, tragically, all died within 2 months of each other. I mean, who goes through this? Horrible, horrible. And then she almost died. She was in a coma for at least a week due to COVID. She had a history of health issues. And she was in a coma, and she could hear everything, couldn't move, and didn't know if she was going to live or die. She had a medical issue which kept her from being able to work. So, she needed to get the medical issue resolved, but she had such intense fears of having another coma during surgery that she was putting it off. So she was having to live with relatives, a lot of them she didn't care for, due to a lack of income and health issues. And one time she was living almost in a closet on a little cot in a lot of pain, a lot of discomfort, and just the whole world seemed like it was against her. So this is pretty heavy-duty stuff here. So her first act when she came in was she told me her story, and I honored her story. Always honor the stories. Don't cut someone off just because you want to be clever, do a technique. Make sure that they feel heard. Because when they feel heard, that therapeutic alliance is built, and then we can get to Act 2 a whole lot easier. But she came in, told me about her depression, her anxiety, her grief, all the things that I just talked about in detail. And I just, all I did was give her support and just told her I admired her courage of getting through those things. So then I asked a little odd question. I asked about, when you're not depressed, anxious, and grieving, what do you do for fun? Is there anything, even just a minute? And she said that she liked to watch what she referred to as trash TV. And she had some favorite TV shows. So I asked her, what's trash TV? And she said trash TV were these, what we call reality TV shows, where a 90 Day Fiance and all these kind of, a little bit wild and maybe not the best quality television. But I asked her, what do you like about those favorite TV shows? And she says, I'm very interested in the people. And I often wonder what makes them do certain things and feel certain things. And in a way, I kind of, feel like, they're, whatever they're going through is important and kind of learning about them. So already, right there, Act 2, here comes Act 3. So what we started talking about is, I said, I find it interesting where a lot of people would just watch those shows without any concern about the people in them. Here you are, really getting into the shows. It's like you care about people at a deep level. It's like you're here to help people. She just kind of looked at me and she says, I've always wanted to help people. I said, if you were going to help people, how would you do that? Led us into Act 3. She became what I'm going to call the advocate. We designed in that one session, even though it was a future goal, she wanted to become an advocate for young girls who had come up the way she had or who she could help rescue from going into the situations she was in and had to go through. She wanted to start a nonprofit organization, which she eventually did, to kind of help these children. Once she got on her feet, that was her goal. Well, you know what I did? I just went with it. That's just asking that question. Open this improv thing between us and led her into how she was an advocate. And I built on that. And how can we make that happen? How soon can we make that happen? What's the first step we need to do today to make you the girl's advocate? How can we get you to a place you need to be to where you're helping girls? How can we get you this surgery and work through this fear so that you can advocate for these girls? Because you can't do it in the present sense. And so it became a goal moving to a future goal. Not talking about depression, anxiety, and grief for hours, even though, I don't, if someone wants to go there or needs to, I'm not saying don't do it. But right now, the advocate had energy. And if I had been so locked into a solution focus, problem focus, interactive kind of thing, I might have missed the gold that this lady had. So the real true solution-focused therapists are really resource-directed therapists because they try to find solutions that are outside the dynamic of the attempted solution and the problem. And that's kind of what we did. If I hadn't just asked about something that had nothing to do with the problem, we wouldn't have gotten to that. She wouldn't have become the advocate. She would have continued to, I think, stay where she was, and she was an amazing resourceful woman, and I learned a lot from her. So let me give you another case just to give some examples here. So Brandon's a client I saw. His wife had left him and took their daughter with her, so he got very limited visitation due to all kinds of things here I won't get into, but that had a lot of extra financial pressures due to the alimony and child support. And he had a lot of stress due to changes in the management where he worked. He had a decent job, but with having to pay all this extra, 2 houses essentially, he's stressed out, hurt, depressed, and he started drinking more to try and escape his grief, essentially, because depression is kind of like a death in a way. Those of us who've been through it, you just kind of feel like a part of you's died, and it's really tough. And then when you have all these pressures of the financial issues, not able to see his daughter as much as he could before, it's a hard thing to go through. So our session, if we're going to score it as Act 1, was depression and divorce. And, this is his life, and this is where the focus of his life. He works and he tries to cope with the depression. So again, we listen to the story. We hear what is going on with the client, and we honor that. After a little while in the session, I noticed that Brandon was actually a very well-dressed guy. He was wearing nice clothes, but he had a sense of style about him. And I noticed that. And the main thing is I noticed he had, Act 2, this really cool scarf. So I complimented him on the scarf. And I asked him, who picked that out for you? And he told me he did. And I said, well, do you pick out all your clothes? He said, yeah, I do. I actually like picking out my clothes, and I like to kind of change and play with certain ways of dressing based on the context of work, and he started talking really about clothes, and then all of a sudden I just felt this urge to go, you ever thought about teaching other guys to do that? Because I'm one that probably needs to learn. Now I'll tell you this, me myself, not stylish at all. You can ask my wife, just not good at the style. But he just had this natural affinity. And we got talking about it, and I started asking him for advice. Well, I'm wearing this type of shirt. What would be good? And he starts telling me this. And then I said, you ever thought about helping other men? Because a lot of men, particularly single men, maybe even divorced men, might need a little help with style. And maybe, you could channel some of your energy into helping other men who, a lot of us don't naturally see good fashion and can't think that way. Which led us to Act 3. He became the fashion expert. Now I'm calling him that because what we did is I really encouraged him to think about that, and maybe he could start writing a blog or having a YouTube channel. And he actually followed up and started writing about men's fashion and kind of focused on divorced men, middle-aged men, and those kind of things. Men who might not have some really nice partner to help him, who had a stylish eye. And he started putting his energy into that. It didn't cost him anything, and it was a resource. It was a strength he had. So what he started doing was building community through his blog or social media, and that eventually led him into interacting with other men who'd been through similar things, and he's helping them. So he's wanting help, and he's helping them, and next thing you know, as problematic as his life was, it actually started giving him extra money, extra connection with other people, got him out of the house more. And last I had heard, he was really doing almost like a side business and doing well and having a lot of fun, which helped a lot with navigating this depression. And the more he focused on being the fashion expert, the less he focused on being the divorced father, being the single man on his own, trying to support two households. So it's really depending on where it goes. If I hadn't asked and just improv, just where that's going with the scarf, which opened up something to the Act 3 of being the fashion expert, who knows how much longer the sessions would go, if he'd get better. People thrive when they have a goal that they believe in, they have a resource they can access, and a strength to build on. So let's recap. So I think improvisation helps therapists, coaches, hypnotists, any type of healer, where we're talking about emotional and mental healing, and escaping these kind of limited pathology discourses we get ourselves caught in. The more we talk about problems, the more the problems become solidified. So it helps overcome regimented therapy by avoiding predetermined theories, any kind of rigidity in our techniques, any kind of scripted methods that kind of limit us. And it increases our interaction with the client and the activation of those strengths and resources that they have. So I encourage you, if you get a gut feeling, be open to it. Don't try to force it. Don't try to go into a session and go, well, today I'm going to be very, very improvisational and spontaneous. Just allow it to unfold and see what happens. You will know. You just have to learn to trust yourself. Well, thank you for spending the time with me today. I'm Paul J. Leslie. My website's drpaulleslie.com. I have some good information on the site, particularly my online course that you may like, called Secrets of Creating a Magical Session, designed for therapists, coaches, and healers so that they can make the most of their sessions and have a little more inspired outcomes in their work. I appreciate you joining me today, and I hope this has been helpful, and I look forward to hearing back from you. Feel free to leave a comment, and please subscribe if you like these videos. Thank you.